This show is part of the Recovered Life Network. Check us out at recoveredlife.tv.
When an individual enters the criminal justice system suffering from severe mental health conditions or substance use disorder, society expects correctional facilities to provide a safe, secure environment that facilitates rehabilitation. The goal is not merely confinement, but returning individuals to their communities in a healthier, more stable state. However, according to an investigative report published by BBC News, severe systemic gaps in prison healthcare and post-release support continue to leave vulnerable individuals exposed to acute crisis, leaving families searching for answers after preventable tragedies. The investigation highlights how overstretched medical units behind bars often struggle to manage complex psychiatric conditions, trauma, and addiction. Inmates frequently experience delayed diagnoses, interrupted medication schedules, and limited access to specialized therapy. The crisis becomes particularly dangerous when individuals complete their sentences and are released back into the community. Without structured handoffs to local mental health teams, immediate access to housing, or continuous addiction treatment, former inmates face an abrupt, chaotic transition. This sudden loss of support creates a dangerous window where relapse, severe mental collapse, and fatal overdoses spike dramatically. In response to these findings, campaign groups, healthcare professionals, and grieving families are calling for a fundamental overhaul of how correctional facilities coordinate with public health services. Experts emphasize that true public safety requires establishing seamless continuity of care, ensuring that psychiatric treatment and addiction recovery plans initiated in custody continue without interruption on the outside. By expanding community-based mental health diversion programs, funding dedicated reentry navigators, and prioritizing compassionate healthcare over pure punishment, society can break the costly cycle of crisis and incarceration. Ultimately, the BBC's investigation delivers a vital reminder. The health and well-being of incarcerated individuals is directly tied to the safety and health of the wider community. Addressing systemic failures in prison mental health isn't just a legal duty. It is a moral imperative that saves lives, restores families, and builds a safer, more humane justice system.